When I run into former patients, it's always gratifying because the vast majority are feeling better. They're happy to be feeling better. They identify you as a positive influence in how they're feeling better. It's great to be in a field that can make a difference. My mother's a physical therapist. She took a lot of pride in taking care of people and kind of having purpose, more importantly, making people feel better. So it was kind of maybe the primer to an interest in healthcare. And once I got to medical school, I was exposed to surgery, working with my hands, and once cardiac surgery rolled around, there was no turning back. What interests me about surgery is the immediacy of it, the ability to fix somebody right there and then. It is really gratifying to fix somebody's pathology and potentially be life-saving. In cardiac surgery, we're sometimes operating on a beating heart. We're in the chest cavity. The heart itself is a very dynamic organ. Between the muscle and the various tissue fibers, the electricity, the machine-like pumping of the heart, there isn't another organ like it. The vast majority of what I do is coronary bypass surgery for ischemic heart disease, patients who are at risk of having heart attacks or have had one recently. Valvular heart disease, where for instance, patients with aortic stenosis continue to develop heart failure symptoms and need a new heart valve put in place. I have a particular interest in structural heart disease, so taking the old and frail and being able to treat their valvular heart disease at an advanced age, without having to suffer the recovery of an open heart surgery or big sternotomy. So instead of having a weeks or months long recovery, accessing the groin vessels, wires and catheters, and really able to send somebody home the very next day after replacing a heart valve. In the last 10, 20, 30 years, there's just been kind of an explosion in new technology that is allowing us to think more creatively about addressing heart disease in our patients. The technology continues to get more and more refined. The size of the equipment smaller, catheter sizes smaller. So this is a really growing area of research and development within cardiac surgery that I find exciting. It's certainly cool when a patient tells you that they can breathe better and that they almost instantaneously feel better and like they can go back out and live the life that they once could.